So, Dr. Mallika, our first question is from Cindy, who writes, I was wondering if my husband and I still need to spray mail and packages that come to the house if we are fully vaccinated. Do we need to wash our hands after handling said mail and packages?
It's a good question, right? Because we were all doing that at the beginning of the pandemic. But I would say if you are fully vaccinated, the chances of you getting really sick from COVID-19 are incredibly low. So no, I don't think that people need to wipe off their mail and their packages and their groceries anymore. However, I would suggest that people continue to wash their hands frequently or use hand sanitizer, because you can also protect yourself against other respiratory infections, for example, viruses that cause the common cold. And we're seeing a lot of people with colds these days.
So we don't need to wash the plastic bags anymore when we come home from the grocery store.
That's right, if you're fully vaccinated.
All right, and Dawn on Facebook says, I have a history of blood clots in my feet and legs. Would it be safe to take COVID shots?
So yes, even if you have a history of blood clots, you can and you should get a COVID-19 vaccine. I mean, here in the United States, the J&J vaccine is really the only one that's been associated with a very rare form of blood clot, but the Pfizer and Moderna vaccines have not been. So we know that COVID-19, the disease, can actually cause blood clots that can be deadly and very dangerous. So it is really important that you still get vaccinated.
Very important. And another question from Facebook. Paul writes, my wife and I just got the J&J vaccine, not having any pain from the shot, but I have sciatica. Will it be okay to take Advil or Tylenol now?
Absolutely. I mean, we do suggest that people not pre-medicate with these medications in case they get pain from one of the vaccines. But yes, if you have a chronic condition or you have sciatica or pain even after you get the vaccine, it's okay to take over-the-counter pain relievers.
Smart of people to check, though, to make sure they don't have drug interaction problems. I think everyone's trying to be very careful.
Absolutely, and I'm glad to hear it.
Patricia from Peabody writes, our 50-year-old son and 12-year-old grandson would like to visit us from California in July. They are not vaccinated and don't plan to be. All other members of our immediate family have been fully vaccinated. Are there risks of COVID contagion if we stay in a single condo?
So look, all the family members who are fully vaccinated, they're protected. Unless you're immunocompromised, it is unlikely that you're going to get really sick from COVID-19, like we explained before. However, your son and your grandson who are unvaccinated are still vulnerable and should continue to wear masks and socially distance, especially when they're around other people who are not vaccinated. Those are the ones to worry about.
Excellent. Dr. Mallika offers her best advice, of course, but as always, consult your personal doctor before making any decisions about your health. If you have a question for Dr. Mallika, there are 3 ways to reach her. Her email, drmallika@cbs.com, on Twitter @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.